Hello, let's understand the embryology of the pinna. The story starts with six pharyngeal arches. They are also known as the brachial arches. With time, the fifth brachial arch regresses. Then we are left with just five arches, that is the first, second, third, fourth, and sixth arch. The pharyngeal arch consists of ectodermal clefts, endodermal pouches, and the core that is mesenchymal in origin. Around this first ectodermal cleft, six mesenchymal thickenings are formed. Three mesenchymal thickenings are formed on the first arch, and three mesenchymal thickenings are formed on the second arch. These six mesenchymal thickenings are known as hillocks of His. First three thickenings are formed on the first arch, and the next three thickenings are formed on the second arch. These hillocks of His then fuse to form a single elastic cartilage, also known as the pinna. All of the pinna is derived from the second arch, except one structure, which is the tragus. Here, tragus. Tragus is derived from the first arch. Therefore, whole of the pinna is derived from first arch and the second arch. This was the embryological origin of ear. Look forward for more ear-related videos.